that come up now in marketing are deep penetration, right? Deep penetration, cavitation. Well, that's a bunch of course, you know what, because most of the things that you're treating are less than a centimeter away. Plantar fascia, stress fractures a millimeter away on a bone. Achilles, you're right on the Achilles. So depth of penetration is completely superfluous or moot. It does not matter. Unless, of course, you're doing other things like a gluteus potentially or a piriformis or a very huge person or football player, it may come into effect. But cavitation and depth of penetration and the nomenclature, what you call them, is irrelevant. We've got focus devices and radial devices. And really and I don't want to get into trade names, but there's two machines that are made in Switzerland that are excellent, and we're involved with all these earlier studies. So when
Yeah,
you
so
look at
talk
it,
about some of the protocols now. You had mentioned hallux
that's,
rigidus
again,
and plantar fasciitis.
thanks for getting me so excited. So with the protocols, again, I mean, I get people that call me healthcare practitioner. Well, I'm doing my 10th treatment, or I've had a patient that says, oh, I've had my 7th or 8th treatment. And I just shake my head. Again, that is not part of the protocol. And we're going to get into that in a minute. But you shouldn't be doing more than 3 or 4 ever. And here's another question that people ask. You're going to do your treatments, and then you do the treatment. You wait 3 months and see how they go, because we know from Dr. Wang's study and Dr. Gertismeyer that have published that it takes 3 months to regenerate tissue. And what's really important is we're working on degenerative conditions. So plantar fasciosis, Achilles tendinosis. We're not working on Achilles tendonitis. We're working on degenerative conditions, and we're regenerating the tissue. Or with a stress fracture, we're creating bone morphogenic protein. So these are things that help us heal. But what's important, it takes 3 months to work. So you can do 100 treatments before 3 months. It won't make a difference.